everyone. Thank you for joining us. This is Nikki from the U.S. Chamber of Commerce Foundation. I'm going to be filling in for Jamie this week on our webinar. We'll go ahead and get started in just a few minutes. Hello, everyone. This is Nikki again from the U.S. Chamber of Commerce Foundation. We're going to go ahead and give it a couple more minutes to let other people get on the call, and then we'll go ahead and get started. Okay, thank you everyone for joining us today for the TPM National Learning Network Fall webinar. This is Nikki from the U.S. Chamber of Commerce Foundation. Jamie is also on the line, but she is in Sacramento enjoying a well-deserved break after last week's Talent Forward and pre-conference programming, which many of you were at. So thank you for that, and thank you for joining us today. So I think I went ahead and muted everyone. So if at any point during today you'd like to make a comment, you can either type it into the chat box or unmute yourself to ask a question. We'll be having U.S. Chamber Foundation updates. We have a special guest, Dr. Bizel from Sharing Solutions, who's going to talk about what they're doing to address the opioid crisis and working with businesses. And then we have Olivia from SIU, who will be doing our TPM web tool update. So for the U.S. Chamber Foundation, the new team member is myself, Nikki De Silva. I've met many of you already, or we've been in email correspondence. So for those of you who I haven't met, I started with the U.S. Chamber about 2.5 months ago from Indiana, and I worked for the state government for about 4 years. So I'm really excited to be here, and thank you all for letting me join in with you on this TPM journey. It's been pretty fun so far, and I'm excited to see where we go in the future. So a couple of the new things that we have happening in the TPM space is we are launching a new Academy website, which will be the home for all things TPM. We also have our new curriculum. The new academies for 2020 will go through what we're doing as far as supplemental resources for the TPM curriculum. Just kind of a recap of the pre-conference programming and talent forward from last week, which we also announced our TPM fellows at, and what the webinars for 2020 will look like. Okay, so the new TPM Academy website. This is for anybody who wants to learn about what TPM is. It has everything about it, our fellows, our faculty, our curriculum, the stories, so all of those case studies like Arizona, Upscale Houston, all of those will be on this platform. This will also be where we will put the application for the 2020 TPM National Academy, which will launch next week, November 6th. And I'll talk a little bit more about that later on. So everything you'll need, where the map will be here, previous cohort information will all be on this website. And the website is called tpmacademy.org. So as soon as that's ready to launch, we will let everyone know. You can go to it now. It is an active website, but we are still making a few changes before we do a full launch. As many of you know, last week we also released our new curriculum. So this is the upskill curriculum that includes all of the changes that Arizona was able to implement, and with the help of all of the practitioners over the last few months, we've been able to really put together a new curriculum that addresses being able to upskill your current workers and kind of think about what that looks like from action plans. We also updated our graphics and the competency and curriculum mapping pieces of Strategy 5. So if you haven't gotten a copy of the curriculum, it is online for you to download, both on the U.S. Chamber Foundation website, but then also the new tpmacademy.org website. And moving into 2020 and our new academies, we will be launching California next week, so that is very exciting. We are also still looking for deciding on what will be our next state-based academy for 2020. We've received a few applications for that, and so in the next couple of months we'll be determining what is the best place for that next state-based academy. In addition to that, like I mentioned, we do have our national cohort that will be launching in 2020. So applications will go live November 6th. and the dates for the Academy will be February, May, and July for the in-person meetings with the webinars in between. The May one is 3 days because that will include our spring summit for National Learning Network members. And all of the meetings will happen in Washington, D.C., and tuition will be $3,000 plus the cost of travel. So if there are people that you know that would be interested in going through the TPM process, start thinking about that and be ready to recommend them to apply. We'll be sending out emails to the entire National Learning Network that lets you know when that is available and where to send people to fill out the application. On top of the new academy and the new curriculum, we are always looking for ways to expand what can be done with TPM and making sure that we're addressing the different areas in which it can be applied. So next week, we'll start our research and development for CTE applications of TPM with our review committee. And then we are going to be looking at doing one for opportunity populations. So if you are interested in applying, please let us know if you want to be a part of developing what those supplemental resources or kind of identifying and addressing ways in which TPM could better serve these populations. We would love to have you be a part of that. Mike Baker asked, is there a deadline for requesting a 2020 In-State Academy? That is a great question. I will ask Jamie and get back to you. All right. So just a recap of everything that happened last week. We started it off with the pre-conference programming for our National Learning Fall Summit. We had almost 60 NLN members in attendance and had somebody from every academy, which is incredible. I know Jamie was really excited about that, and the room was packed. So we were really happy to have so many people there, and hopefully you all found it to be of value. We covered topics like staffing capacity, developing funding streams for sustainability, TPM Next, which is the next iteration of TPM, and that includes our new partnership with the Association for Supply Chain Management and looking at how we can professionalize and scale TPM so that it's accessible to everyone. And we also discussed opportunity populations with Grads of Life and provided options and opportunities for networking. If you still haven't filled out the survey, please let us know what you thought. I'm happy to send you one if you weren't able to fill one out at the time of the event. We would love to know what we can do for next year's summits. And Talent Forward last week. Thank you to everyone who came. We had almost 70 National Learning members there. All of the content from that day is available on the Talent Forward website. So if there was a PowerPoint or speaker that you wanted more information on or wanted to revisit, you can do so on that website. We will be releasing the dates for 2020 soon. And we're looking at expanding what topics we're discussing so that we're encompassing the entire pipeline from early ed all the way through upskilling. And then very exciting, we launched our TPM Fellows. So these are, our cream of the crop top TPM practitioners who are hand-selected based on their involvement and deep understanding of what it takes to implement workforce solutions. And so they will serve as kind of advisors, guide and provide guidance in what the expansion of TPM looks like as we continue to evolve. These are the people that we will likely lean on to kind of provide that guidance, that practitioners on the ground, understanding of TPM. So we're really excited to have this, and we hope to continue this as an additional layer of having that kind of continuous improvement within TPM. So congratulations to all of those listed here. I think we have 13 TPM fellows, so congratulations to all of them. Oh, why did we go backwards? Sorry about that. The 2020 webinar dates. We will have 4 webinars as normal. That will be on January 15th, April 15th, July 15th, and October 14th, all at noon. We are looking at, because of feedback that we've received, doing some industry-specific webinars. We do know that we'll have one in February on construction, and depending on how that goes, we will expand that into other industries that people have high interest in related to TPM. And as always, the recordings for all of the webinars will be available for you to view at any time that you'd like. Okay, that is all I have. If anyone has any questions, I'd be happy to answer them. Otherwise, I will turn it over to Dr. Bazell for his presentation on sharing solutions. Okay.
Good afternoon. How's everyone doing?
We're good.
Okay, great. Awesome. As I mentioned, I am Dr. Anton Bazell. I'm a U.S. Chamber of Commerce Fellow and also the Chief Executive Officer for the Bazell Group. We're one of the fastest growing companies here in the Washington, D.C. area. And as Nikki mentioned, we're here to really share with you some information about what the Chamber has done around the opioid epidemic, and really share with you an awesome toolkit that we have called Sharing Solutions. So we can go to the next slide. We're going to get started. So I'd like to normally begin, as you know, we're on a 10-city tour. We have 1 city left to go. And I normally start by saying this quote by Norman Vincent Peale, which pretty much says that every problem has in it the seeds of its own solution. And I believe that we're in a particular time right now where in the opioid epidemic that we're seeing where we are the seeds, and we have those seeds to really solve the issues that are out there. And really, when coming to the business community, we know that really the opioid epidemic has really impacted every aspect of American life values and ingenuity in ways that we could not have even imagined. And the American businesses of all sizes are really feeling the brunt of that impact. So really, if we go to the next slide, we'll see how really the opioid epidemic has really impacted everyone and is destroying communities and families across America. We're seeing deaths at astronomical rates. And really, in order to really address this crisis and the scope of this magnitude, everyone has to really take a part in this, which includes the business community. So we know that businesses really are vehicles to really help solve the problem. Next slide. When I started the Bazell Group, just to give you just a little bit of background about who I am, when I started the Bazell Group, I really started with a small team of experts trying to really build some meaningful projects around the world. And at Bazell, our motto is pretty much our clients drive real world change, and we accelerated. But since 2003, Bazell has really been at the forefront of public health issues, including the opioid epidemic as well as opioid use disorders. We provide technical assistance and training, communications, as well as many other types of data analytics around the prevention, treatment, and recovery services for substance use disorders. And I myself, I'm a former medical officer for the Substance Abuse and Mental Health Services Administration and have been involved with opioids since 2003. So I saw that joining Sharing Solutions really and joining the Foundation's team was a perfect fit. And if we look at this slide, you see that we're located here within the Washington, D.C. area, but we also have offices in Atlanta, Georgia as well. And we definitely, I believe we know a little bit about business. We're one of the fastest growing companies in the D.C. area, Washington Business Journal, Inc. magazine as well. And so we too have, addressed this from a business standpoint. Next slide. what we have to do as well, and you see some of the other areas that we are focused on: outreach, evaluation, community engagement, and technical assistance. Our staff have really been involved with, some of our staff have been involved with medication-assisted treatment for nearly 30-some years. We have also trained well over 10,000 providers on remaining pharmacovigilant and not getting in trouble when it comes to prescribing practices. We are providing video production for the National Institute of Drug Abuse, as well as many others around buprenorphine, methadone, naltrexone. We are working with everyone in the prevention and the treatment and recovery field on really addressing the current opioid epidemic. Next slide. So as we see today, to get into just some of the stats, we really see that there's about 2 million workers that are not in the labor force each year due to an opioid use disorder. And unfortunately, that number is really growing every day. So businesses, small and large, have been in fact impacted by the opioid epidemic. We see everything from employee attrition to absenteeism to higher healthcare costs. And we're really seeing that impact in more ways than one. And so as a business owner, this is the reason why I really leapt at really joining the U.S. Chamber of Commerce Foundation to really help in the efforts to build businesses and help them combat the epidemic. And so we know that awareness is the centerstone of any solution, and we're hoping that really sharing solutions can be that resource to really drive change across the nation. Next slide. What you'll see here is a few slides that will talk about the opioid epidemic. We have well over 47,000 individuals who have died in 2017. We're waiting for the new numbers to come out. And if you look at just overdose deaths overall, we're talking about 70,000. So you see where that's a large number just attributed to opioids. We see that there's about 36 pills that were prescribed for every person in the U.S. And about 174 Americans die of a drug overdose every day. And this is costing anywhere, and estimates really are between $500 to $700 billion a year as the cost to America. And again, drug overdoses have doubled in the last 10 years. So next slide. 50% of the people who misuse prescription drugs got them from a friend or relative, and 22% of them got them from a doctor. Combined, we're seeing somewhere like 72% that are getting them from a physician or a relative or friend for free. And about 4 out of 5 people who are addicted to heroin report that their addiction started with pain pills. Next slide. Now, those that in the field, we know that we're in the third wave of seeing overdose deaths. We saw the first wave, which really occurred from really the prescribing practices of physicians. We saw deaths occurring like in 2001, started seeing that rise as well around 2003. And then we start seeing some other synthetic opioids as well, and heroin. So as we started getting a handle on prescription opiates from the doctor shopping, as well as getting them from the family and friends, we started seeing people moving towards heroin. And now we're in that third wave of the heroin that's now laced with clandestine fentanyl, which a good majority is coming from China as well as India. So now this is what we're seeing. So across America, we're seeing where prescription opiate use is actually decreasing because we're making waves and coming up with great strategies to really address it. The problem that we're having right now are the deaths. And the deaths are occurring because of the drugs that are coming in, the clandestine fentanyl that's coming in, and that's being laced with fentanyl. But we're starting to see across some states that now fentanyl is being put into cocaine, which is another white powder. And this is going to be another wave that we're going to see. And so we really have to look at what are the strategies that we can work with our employees, with the family members, and with other business owners that could really address this. Next slide. And this really shows you just a little bit more. In the last 15 years, overdose deaths have increased 4 times. And then 16% of state budgets are spent on addiction and substance use, and nearly a third of all hospital visits are linked to addiction. And it doesn't matter, it doesn't discriminate whether it's in rural areas or more urban areas, but we're seeing increases really across the area in large cities as well as in rural areas. Next slide. So the economic burden, we've talked about this, we can go to the next slide. And then also you see some of the numbers that we're seeing. About 435 million was for prescription drugs. When we look at the number of individuals with insurance coverage, they received $2.6 billion in services for the treatment of opioid addiction and overdose, which has been going up by 0.3 billion since 2004. 1.3 billion was for outpatient treatment, 911 million was for inpatient care, and 435 million for prescription drugs. Next slide. And that comes to about $2,600 per person. So really, what drove the U.S. Chamber of Commerce Foundation to really get into this? Around October of 2017, President Trump declared the opioid epidemic a national public health emergency. And so the White House was estimating around $504 billion at that time each year was spent and was the economic cost to the U.S. So the U.S. Chamber of Commerce Foundation, they decided to heed the call to action and how to empower employers during this epidemic. And what we found was that we knew that the resources on addressing the epidemic, they existed through nonprofits, medical schools, the government websites, but the information was really scattered. And so what we saw with Sharing Solutions was one place that we can bring all the information together. So the Chamber surveyed most of their Chamber of Commerce's, local Chamber of Commerce's, and what we were able to do was really curate all the data from the employer lens to really provide an extensive toolkit for small and medium-sized businesses who didn't really have the bandwidth to really have access to these resources. So this was really how Sharing Solutions was born, or how it was created. Next slide. And what we like to say is really not enough just simply to develop a tool, but we have to really get the word out and let employers and employees know where they can get help. So we kicked off really the Sharing Solutions tour in Abington, Virginia. We've gone to West Virginia, Pennsylvania, Ohio, Massachusetts, and we're headed to South Carolina for our last stop. But what we've seen since I've met a number of business leaders on tour and many advocates, and all have really began to share their stories and best practices as it pertains to the epidemic. And I would invite everyone on the call to really visit www.sharingsolutions.us. Again, that's www.sharingsolutions.us, and you'll find all the information that we're presenting right here. Now, just to go into just a little bit, just to give you a little background on the effect of business, we'll go to the next slide. Among employers with a drug-free workplace policy, 43% also have a first offense forgiveness policy, which connects the employee to treatment rather than immediate termination after the individual's first substance use or related workplace incident. One of our first panelists was from Belden, which is out of Richmond, Indiana, and they found that they had more jobs that were available than people who were able to pass a drug test to obtain the jobs. So what they did, they linked up with a treatment center called Centerstone, and they were able to allow individuals to come into their job site, have a job in a safety-sensitive position, and to also go through treatment at the same time. With that said, once they completed that treatment, whether it was 12 weeks or longer, and they were successful, Belden actually gave them a higher functioning position within the company. And I'll just want to say that they've had some great success in having this program really in the last year and a half. Next slide. We also see where, what are employers saying? Employers are most concerned about the cost of benefits, the ability to hire qualified workers, and also the cost for workers' comp, but less concerned about drug misuse and illegal drug sale or use. But workers in recovery have a lower turnover rate and are less likely to miss work days and less likely to be hospitalized and have fewer doctor visits. And so that's one of the reasons why we feel that, this program is one that we're offering solutions to those businesses, whether small, medium, or large, that can really look at their practices to see how can they potentially change their practice to really work with those individuals who may be suffering from an opioid use disorder, and to also allow them to have employment, because we do know that individuals who are suffering from an opioid use disorders, they really need to have that stable environment to remain pretty much off of the medications and compliant. So next slide, we'll move to some more things about what employers can do to make a difference. the next several slides, you're going to see several things that can occur from employers. Ensure that the work site is safe and the working conditions do not lead to worker injury or illness or contribute to painful chronic conditions such as carpal tunnel and all those types of things, because that will require more pain meds to the individual. Identify clinics that provide evidence-based treatment for injured workers. Also provide adequate leave and other benefits after workplace injury, including flexibility in scheduling and receiving medical care and support during recovery and return to work. Next slide. Also, taking steps to manage workplace stressors and job insecurity to the extent possible. Take steps to decrease the stigma associated with substance misuse through awareness building and supervisor training. And we're really seeing that this is really making a major impact within the employment environment. And so when CEOs take up this mantle and really share their concerns with the entire company, we're seeing where it does make a difference in changing attitudes when it comes to treating individuals and also getting the help that's needed or even prevention efforts. And also educating workers about how drugs impair work activities, including driving, and encourage them to notify the employers if they're taking medications that it may affect their ability to work safely so that a safe solution can be determined. Next slide. And what we're also seeing, especially in the construction industry, when individuals are up on scaffolding, we're already seeing about 3 people who are dying in the U.S. every day. Imagine combining that, liability with prescription opiates being on board, and which is causing increased liability of workplace injuries as well. Employees can also make a difference by developing and communicating clear drug-related workplace policies that include or offer assistance to workers with the opioid use disorder, or offer comprehensive treatment to options of workers with an OUD. And also work with health plan providers and pharmacy benefit managers to attend to inclusion of such coverage in employee health plans. And this is where we're finding a lot of information as well and support that's going on from employers who are now putting in policies when it comes to the number of physicians that they can even go to, or even the number of pills that they can even get. And employers are actually dictating that. And we'll see a little bit more as we move along. Next slide. And employers should also consider when to arrange for medication-assisted treatment, such as how I explained the Belden and Centerstone relationship. Next slide. So really, sharing solutions is one of those things that the U.S. Chamber of Commerce Foundation, they want our businesses and communities to really be engaged in the fight against opioid misuse and abuse. So as employers, we have to really think outside the box and really to brainstorm not necessarily new, but alternative ways to really help our staff. So shared solution isn't just a one-way street or resources. It's intended to really be interactive and engaging. And so you actually see some of the pictures of what the website looks like. But again, I encourage you to go in and visit. On the website, you'll find resources for employers or employees, state-specific resources, such as where to find treatment, whether it's methadone, buprenorphine, or some alternative treatments. And also Business Combating the Opioid Crisis Library, where we're showing how we will support employees, how businesses can change business practice, applying for competencies, or engaging in communities. And also other ways that if you could think of ways that will be beneficial, where you can also share your story. Next slide. And just so you'll see some of the things, and we'll move through this pretty swiftly, in supporting employees, employer drug misuse prevention and treatment initiatives are really keeping employees and their families healthy and safe. Leidos, their CEO, Roger Crone, after the death of one of his employee sons, started the CEO Pledge, and you can find it also on the Sharing Solutions webpage. And this actually sparked an interest with many other CEOs. And so you'll find where you or your company can also be a part of this as well. Also, there are industry groups, which I made a mention earlier about the construction industry, how they're trying to make construction safer. We talked about Belden, also educating employees on the signs of opioid misuse. Also, opioid forums for employees, so GE Health is doing that. And also training managers to stop drug abuse, like the National Association for Home Builders. Next slide. Changing business practices is where we look at companies in the healthcare pipeline where they're making operational changes to really mitigate and to prevent opioid misuse. So we're seeing like disposing unused medications safely, CVS Health. Walmart is doing where they're limiting excessive opioid prescriptions. Blue Cross and Blue Shield, new clinics for individuals with substance use disorders are being implemented in many places, especially in rural areas. Anthem as well is also doing pharmacy home programs where they're identifying as a company or as a health insurance where you have one pharmacy or one provider where you can just get your prescriptions from. And also supporting early identification, treatment, and recovery by improving medication-assisted treatment in rural and underserved areas. So what they're trying to do also with Anthem is to put one physician that is trained in medication-assisted treatment in each primary care practice, especially in rural areas. Next slide. Core competencies and how do we apply that? Optum is also doing cutting-edge treatment for all public-private partnerships where they're engaging students. This is through discovery education, and that was with the cooperative agreement with the Drug Enforcement Administration, and also bringing people together from nonprofits, businesses, government, and healthcare through the Amazon Web Services Opioid Crisis Council, and also the Opioid Response Center for Business, which is in Kentucky through their Chamber Foundation. Next slide. And also engaging communities, helping local groups through philanthropy. AmerisourceBergen, which is a top 10 Fortune 10 company, also training staffers at libraries and YMCAs on recognizing overdose and naloxone administration, as well as social media through Facebook and others. Next slide. And so, as we know, one of the things that I like to end on is this quote by Nelson Mandela, which says, "It always seems impossible until it's done." And so we know that I normally like to leave individuals with that quote because we know that when Americans really come together in every crisis that we face, there's nothing that we cannot accomplish. So when we really are band together, armed with knowledge and resources and compassion, we can really accomplish anything. And so I'd like to now open this up if there are any questions, so that if anyone has any questions, we can definitely answer that. And you have my contact information here. Feel free to reach out to us. We have staff members that are able to answer any questions, and I myself will also answer any questions. So if you have any questions, available right now.
Great, thank you so much for that information. I think it's really helpful and impressive to see what resources are out there and how you're bringing them together to be better used by business. Does anyone have any questions? And just remember, you can either do it through the chat box or unmute yourself and speak. All right. Well, thank you so much, Dr. Bazell. That, like I said, that was very informative, and I'll make sure that everybody gets a copy of this presentation that has your contact information on it.
Sounds great. And like I said, I definitely encourage everyone to visit sharingsolutions.us or to get in touch with individuals from the Chamber Foundation who can answer any of your questions. And thank you all and have a great day.
Thank you. All right, I'm going to turn it over to Olivia Miller from Southern Illinois University to speak about the web tool and what updates we've been doing to make it a better tool for everyone to use and to adjust it to the new curriculum. Olivia, are you there?
Can you hear me now?
Yes.
Sorry. Hi, everybody. It's Olivia Miller, and I'm very excited to be on today to go over some of the great updates that we have pushed out to the TPM web tool. So we'll go ahead and dive right in, and then afterwards, if you have any questions, we'll dive into those. Next slide. Perfect. So one of the big updates we have just recently pushed out, and we will probably have a few updates to go along with this, is all 3 of our TPM surveys have been updated to include additional response types to the extra questions you can add on to the end of your survey. So we used to have a yes, no, and a text option for the answers, but we have now included a drop-down option, a checkbox box option and a rating option. So we can allow for single choice, multiple choice, and additional ratings of importance through 1 to 5, like we do our competencies and employability skills. So we're going to continue to kind of beef that up a little bit, but definitely let me know as if you guys are using the tool, if you have any feedback on anything that would make that feature more user-friendly. The second update we have is also in regards to our surveys. So all 3 surveys have been updated. So you can now identify a name and an email you want the survey invitation email to appear from. So it used to come from the TPM web tool email, and we were experiencing some issues with people either ignoring it because it was an unknown email, or maybe it would go to their junk email and they wouldn't see it. So now with the help of Mailgun, you can type in a name and an email, and when they get that invitation email, it will show as if it was sent from Olivia Miller through olivia.miller@siu.edu. Additionally, if anybody is to reply back to that email with maybe questions or comments, Mailgun will redirect that email and send it to you to allow for that back and forth communication instead of it going to the web tool and then it have to be forwarded to you. So we have had that out for a while. We've got a lot of really great feedback. Another great feature with this is that we can now better track the emails and where they're sending and if we experience any issues. So if you do have any questions about did somebody receive this or not, we have the ability to go in and figure out what happened with those emails that were sent, so you can always reach out to us. Next slide, please. The other updates we have are also in regards to all 3 of our surveys. One of the things that we have recently updated is that you can now invite business admin users who may not have completed setting up their account. So maybe you sent them an invitation to create a TPM account, but they haven't clicked on that link and went through and got it set up. Well, now you can still go forward and invite them to the survey, and it's going to send them a special link and that email invitation that will first prompt them to finish creating their account, and then will directly take them into the survey in which you invited them to. This will not only help for ease of access of being able to invite people to get to that survey, but it'll also help encourage users to set up that survey with eliminating some of those steps, make it more of a flowing process to just kind of get through everything. Next slide, please. So the other update we made to the survey invitation process is we included a link that you can copy and manually send via email, or if you want to put it in a document or send it in a chat, you can easily do that. We do have some notes on there though that the manual link can only be sent to users who have accepted their TPM account, because the other option would send them a special link, and this manual link isn't going to have the ability to make sure they set up that account first. So we've included icons next to each user's name to identify if they do or don't have an account, to make that an easy process for you all to figure out as you're going through the invitation process to invite people to your surveys. Next slide, please. Questions. So that covers all of our updates. So I want to open this up to any questions you have about the updates we just covered, or anything regarding the web tool in general. Alrighty, I don't see anybody chatting anything, and if anybody's trying to talk, there's no audio coming through.
All right, well, thank you, Olivia, for that update. We really appreciate all the work you do for TPM and with the TPM tool, and we're excited to see where it goes in the future. So thank you. If anybody has any additional questions, you can always email Olivia, myself, or Jamie, and we're happy to help you through any part of the web tool. Okay, and that is the end of our webinar for today. Oh yes, can Olivia already answered the question, Kristen? There you go. This is the end of our webinar. If anybody has any last minute questions or anything that they'd like to add, please feel free to do so. Happy to answer them through the chat box, or if you'd like to unmute yourself. Seeing no questions, we'll go ahead and, oh, one new message. Yep, seeing no questions, we'll go ahead and end early today. Thank you all so much for joining in with us, and we will see you in 2020.
Thanks, everyone.
Thank you.
Yes, thank you.